In less than 3 weeks, fall begins. That will mark the start of 3 seasons since the COVID-19 pandemic began. No other crisis in our recent history has called on our bravery, on our commitment to each other, and our unity more than this crisis. It calls on us to be informed. It calls on us to be responsible. And it calls on us to be motivated. It calls on us to act with one another's health in mind. To that end, we've taken steps as a city to lower the transmission of the virus, and these steps have allowed us to see a measure of success in recent weeks. So today, Dr. Caine, the great leader of our Marion County Public Health Department, will update us on the most recent data. But first, we do have several updates around restrictions that I want the residents of the city of Indianapolis to know, be aware of, and therefore act upon. First, the main road closures for our Dine Out program, which include Mass Ave and Broad Ripple Avenue, those road closures will end after Labor Day as we transition to a more sustainable model that we hope will allow us to keep expanded outdoor seating in place. That being said, we continue to encourage businesses and restaurants to arrange for outdoor seating and dining while weather permits. And our Department of Public Works and Department of Business and Neighborhood Services stand ready to continue helping area establishments creatively expand their outdoor capacity, including the use of the public right-of-way where it is feasible to do so. One last note on these street closures, as I know it will come up at some point. Yes, I have been personally impressed with the usage of these temporary public places and spaces, especially as multimodal thoroughfares. And that's why I can understand those who are pushing for permanent closure. But to be clear, despite the great partnership we have enjoyed with Park Indy under the city's long-term parking meter contract, there is simply no financially feasible way to permanently close streets within downtown parking meter zones governed by the 2010 contract that the city of Indianapolis entered into. The cost would be in the tens of millions of dollars before a single penny is spent on design or construction. So while we'll continue to study the long-term methods, the long-term needs of our commercial corridors, right now my focus continues to be on using limited city resources to help those utilizing these streets today and others around the county. And to that end, I am heartened this morning to report that based on the encouraging data that Dr. Caine will discuss in a moment, beginning next Tuesday, bars and nightclubs in Marion County will be permitted to reopen at 25% indoor capacity, with up to 50% capacity utilizing outdoor seating. I want to make two important points here. First, the reopening of these venues will only allow bars and nightclubs to offer table seating. And when I say seating, I mean that it will be mandatory for customers to be seated at tables no larger than what we will accommodate 6 people. And bar top seating will continue to be closed. Secondly, the reopening of these venues will only last so long as business owners and customers take their obligations under these public health orders seriously. For residents, customers, that means staying at your table and masking up whenever you need to move around. And I promise you that Dr. Caine and her team will go full footloose on your business if you're operating as a dance club. As it relates to all other aspects of our existing public health orders, they will remain in full effect for the foreseeable future without change. I know these updates will not satisfy every Indianapolis resident. You know, I wish I could satisfy all residents. Those who own businesses threatened by closure, those who fear a previously non-fatal health condition could become fatal with COVID, those who resent the mask order, those who want more to wear masks. Sometimes the decisions I'm required to make please no one. That is why it is important that I make them. Not to please people, but to protect people. Because as I said earlier, this is a moment in which we are called to unite around reliable, discernible science, around shared responsibility, around mutual respect for one another, for each other. 6 months into a global pandemic, we can all see which nations can reopen safely and which are still battling a growing rate of infection. Simply put, unity is what stops this thing for now. To those who mask up for the health of your neighbor, thank you. To the businesses that take these orders seriously and in so doing protect their employees and their customers, thank you. Because of you, we can make these adjustments after seeing the rate of transmission decrease in Marion County. Going forward, we will continue listening to community feedback and, of course, medical experts while monitoring the data. So, speaking of which, I would now like to hand things over to my partner, the director of the Marion County Public Health Department, Dr. Virginia Caine. Doctor?
Thank you, Mayor Hogsett. In a few minutes, I'm going to walk us through our recent data. And as Mayor Hogsett mentioned, our progress in recent weeks is allowing us to take steps toward reopening. But let me be clear, this progress does not mean it's time to relax. If we are to continue to move our county's data in the right direction, to continue to prevent the spread of the virus in our community, to keep our loved ones and vulnerable neighbors safe, and to continue moving toward reopening our city, all of us must continue to do our part. Now, as we saw over the summer, if we do not work together, wear a mask for one another, and maintain social distancing at 6 feet, if we fail to do these things to maintain our progress toward containing the virus, we will also lose the progress we have made toward reopening. Now, this message is especially important as we head into the Labor Day weekend. I do not want to see the community repeat the surge we witnessed after the 4th of July. I urge residents to enjoy the holiday weekend, but safely. Please avoid large groups, wear your mask indoors, and when social distancing is not possible outdoors, wear those masks and wash your hands frequently. Only if we all do our part will we continue to move toward the new normal we seek. And now I'm going to walk you through our county's recent data. So when we look at our percent of COVID-19 tests that were positive, these are the individuals in our community that have positive tests for COVID-19. You will see back in early August that our positivity rate was about a little over about maybe 7.7% positivity rate. And you can see how we have nicely gone down slowly over the month of August until we have gotten to a low of 5.3%. 5.3%. Remember, we said that we're definitely going in the right direction, that when we can get below 5% for at least a minimum of 2 weeks with some other major indicators that we have. And so we're now at the 5.3%. And as you can see, almost for the last 10 days, we've hovered a little bit and been flat since about August the 15th. When we look at the number of people who are getting a laboratory test, based on the size of Marion County, we have to meet a minimum number of tests in order to know exactly what our spread is. And that minimum number of tests we have to have occur each day is at least 1,500 tests. And as you can see, since early August, we've been hovering or nearly around almost 2,000 tests a day. So we're doing really good in terms of what we call sort of a surveillance of the entire community. Now, how are we faring in terms of the number of new cases that we see each day? Because this is the second most important criteria we have to say that we are now getting finally back to our new normal. And back in early August, in the beginning of August, we were experiencing, we got over 200 cases in a day during that early August period that we were seeing. And more recently, we've had our confirmed cases come down, but our last 7-day average of cases at around August the 28th, 29th, we're seeing 117 cases on a 7-day average. 117 cases on a 7-day average. Now, what do I mean by that? So we in the past had gotten down to 45 cases per day, but then we had that July the 4th surge, and we shot back up where we're seeing some days at least over 200 cases a day. So we're getting closer to our goal, but we're still experiencing over 110 cases on a daily basis. So we need to see us getting down to below 10 cases per day on a daily basis. So we have a little ways to go, but we're still continuing in the right direction. We need your help desperately to follow the rules. Next slide. So with our ED visits with COVID-19 symptoms, we've basically sort of been flat. So if you go back early August, we were seeing about 22 emergency room visits with individuals had COVID-19 symptoms hitting our ERs, okay? And then we started to go downward a little bit, but just recently, we're starting to see a slight increase in our ED visits with COVID-19 symptoms. And so we're gonna have to look at that trend very carefully. But overall, we've been basically flat since early August, but just starting to see a slight increase since August the 24th. Next slide. Now, what about our hospital admissions for persons with COVID-19? So as you can see, since April on this map and early August, we have reduced our hospital admissions for persons with COVID-19 significantly. And as you can see now, we were having like 23, 24 cases, hospital admissions a day for people with COVID-19. And we're down to about 14 cases per day of individuals with COVID-19. Now, understand the demographics are changing. So we're seeing a much younger population who are contracting the COVID-19. So they're a little bit more healthier, but also we've gained a tremendous amount of knowledge from the medical professionals how to treat and manage these patients. So we're seeing less hospital admissions related to COVID-19. And really, I contribute this to one, the recommendation of wearing masks that's a requirement, and two, being able to reduce the impact from different businesses, public entities out there, and social distancing related to curtailing this infection. When we look at deaths, the same thing. We've seen a substantial decrease in the number of deaths since early August, so that we're experiencing on some days no deaths whatsoever related to the COVID-19. Now, I think it's always important for us to understand what's happening surrounding us in terms of their COVID-19 cases. So if you look at this slide, and if you can look at Boone County, you will see that essentially Boone County's COVID-19 cases per 100,000 residents has been basically stable and flat, okay? Hendricks County, on the other hand, is seeing a slight increase going up in their new cases per 100,000 residents. Morgan County is flat with their cases, but going up to Hamilton County, we're seeing a slight increase trending up for Hamilton County in their COVID-19 cases. Marion County, we've essentially been flat, okay? Johnson County, we've been essentially flat in our COVID-19 cases. We go to Hancock, and we've been essentially flat in our cases. And Shelby County is just knocking it out of the park. They have nearly half their cases in terms of COVID-19 cases. So when we go to the state level, we see that Michigan in their rolling cases per 100,000 populations average, you can see that Michigan, the state of Michigan, has been basically flat at 7 cases. Illinois is trending slightly upwards with their cases. Indiana, the entire state, is slowly trending upwards, but just looks like this last week, they look like they may be on a downward trend. So we'll have to wait and see what that's looking like. But just, I want to say in the last couple of days, they may be trending downward. Kentucky has been basically flat with their cases. And Ohio have been basically flat in their cases. But Illinois, Indiana, and Kentucky have the highest number of cases by ratio per 100,000 residents. So now let's talk about the difference in the change of the cases based on the age, and see if we can chronologically see what's happened since March of this epidemic going up to currently August. So as you know, that at the beginning of the epidemic, that our largest number of cases in March was primarily in the 60 and above. Nearly 40% of our cases in March were in seniors, 60, older adults, I should say, who were 60 and older, followed by the 40 to 59-year-old group at 35%. So nearly 75% of the cases were in individuals 40 years or higher. And if you look at the 0 to 19-year-olds, that they made up only 1.1%. Fast forward, starting in June, starting in May, but in June, you started to see the 20 to the 39-year-old age group having the largest number of cases at 43% of the cases. And starting to see that going all the way through July, they made up at least 1/2 of all of our daily COVID-19 cases. And just recently in August, they're still above 42% of cases, COVID cases occurring in August. When you look at the older adults now making only 13% of the cases, and the 40 to 59-year-olds making almost up to 30% of the cases. But now I turn your attention to our younger group. These are our 0 to 19 years of age group. And you'll see that we have started to slowly see an increase in the number of our residents who are 19 and under. And as you can see, in July, we went up to 11.6%. In August, 18.2%. Now, let me just say, of the cases of the group age from 0 to 19, nearly 2/3 of these cases are in our 18 and 19-year-old age group. So primarily sort of, you want to say, you can say the early college age group, and those individuals who are not in college, 18 and 9-year-olds making at least the majority of the percentages in this 18.2% of the cases. So less so, Harley, that we're seeing in our 0 to 17-year-old school age group related to the cases. Now, as Mayor Hogsett has said, we have making some adjustments and changes as our numbers have improved in certain categories, and which will take effect Tuesday, September the 8th, 2020, that we are now reopening our bars can reopen at a 25% indoor capacity. And if you're fortunate enough to have outdoor seating, that can be at 50% capacity. but it must be only table service and seating only. You can't sit at the bar stool area. And the bars must be closed at 12 a.m. And let me just say, we had so many violations before in the past that played a role in our closing down bars and taverns. If we are seeing 3 violations coming from a bar entity, this will lead to closures of that particular bar for a minimum of at least 30 days. We are now expanding our restaurants, outdoor dining to 75% with social distancing, and table service is allowed in the bar area. Nightclubs can now operate, but they must operate like a bar and will be at 25% capacity, but no dancing and live entertainment will be allowed. And I got a lot of queries recently, this past week, related to clarification on the schools, because the Indiana State Department of Health has put out new guidelines for when students, colleges, students, and the various schools, they've put out a different algorithm of when you can go back to school in person, everybody, related to their guidelines. Let me just say, hey, Marion County rules are different than the state of Indiana's guidelines. And any school in Marion County, you must follow the Marion County public health orders. Our orders supersede the State Department of Indiana's guidelines in regard to our recommendations. So let me make this clear. You will not be able to follow the state of Indiana guidelines when they differ from the Marion County guidelines. And so please continue to look at our order, public health order from the health department related to guidelines related to schools. One other recommendation that we want to make and make sure that this is understood is that when Marion County school sports teams are playing out of the county schools. So when you're playing out of the county, you're in another county and you're playing another school, I need to make sure that the sports teams and all the staff are following social distancing and masks when playing out of the county. But let me tell you this includes the fans and the public. Fans and public are included in this. If we find that your fans and the public are not following these rules when you're outside the county, it may force us to shut down your particular sport related to where we're seeing violations of that nature. So just because you're not in Marion County, you keep coming back to Marion County. Now, if you're going to go to another county and you never return, then I may be fine with that, but you need to follow the rules and make it safe for everybody, no matter where you go, where you are. And so I want to thank again Mayor Hogsett and his team and his staff. And I want to thank again the citizens of Marion County for all of those who are working very diligently. You know, I have to commend all the school systems. They're working very hard to make this a very safe environment for all of us. Businesses, thank you so much for all the work that you do. And we have so many organizations and groups that are continuing to work with us to continue. You know, we want to be the city in this country to say We had such remarkable collaboration. We had such great expertise, because I remind you, the recommendations we make are based on the science. Let me say that again. It's based on the science. And so we have wonderful expertise, different partners, whether it's with the Fairbanks School of Public Health, we're working with organizations, Results Resolve. We look at guidelines across the country, looking at Johns Hopkins guidelines, Harvard guidelines in terms of some of the recommendations that we make. And we have a great epidemiology department that we continue to do analysis on a frequent basis, determining what are best practices, what's working outside the state in other communities that we can adopt and bring here. So, Mayor, I'll turn it over to you for questions.
That's great. We'll do as we always do. If you have a question for Dr. Caine or Mayor Hogsett, you can feel free to put your name and outlet in the Q&A box, and we'll call on you in order. Our first one up is Russ McQuaid from Fox 59.
And good morning, Mayor and Dr. Caine. I believe you'll both be able to respond to this one. The CDC yesterday sent out an announcement, sent out letters to all the governors saying we expect a vaccine by November 1st. We need help in fast tracking the permits, the licenses, and the locations and cooperation on that. I'm just wondering, Mayor, on some of the administrative issues, and then Dr. Caine on some of the medical issues, how well Marion County and Indianapolis are going to be able to respond to this request.
Well, let me just take the first part of your question, Russ, and it's a very good one. Look, I mean, all of us want to make a vaccine as available and as successful as we can, as early as we can. So in terms of administrative permitting, licensing, any kind of governmental effort that would accelerate our ability as a community, as a state, and as a country to find an effective vaccine, we'll do whatever we need to do as a city to assist in that regard. I would only caution people getting false hope, because I hear the same things coming out of Washington, D.C. and other places. But Dr. Caine can speak to the medical aspects of your question. I just want to reiterate that as a city, we want to fully comply with, cooperate with the CDC, with the State Board of Health, and other partners in finding an answer to this difficult question of how do we protect people as effectively as we can.
Sorry. Okay, sorry, have a little technical difficulties. Thank you, Mayor. I saw the same news reports like everyone else yesterday, and I really am going to look forward with working with the state to administer when we have a safe vaccine that's available. But let me just say, we've had an enormous experience with this. We had H1N1 that occurred, a very similar type of season. And we work with all of our hospital systems to help do our distribution of the vaccines. Our Indiana Patient Safety Coalition, which consists of all of our hospital systems. And then we work with our Indiana Primary Care Association. We have nearly over 24, 25 community health centers that provide a lot of patient care. And working with our medical societies, our Indianapolis Medical Society, our Escalapian Medical Society. So we had a lot of private providers that also made a part of our team in providing vaccinations, because we also have different demographic population. So we have a significant Hispanic Latin population. We have a significant Burmese population. And so you have to make sure that you've got providers that are able to take care of that. So we have a blueprint of how this has been done before. We've already started our discussions about planning and what we need to do when the vaccine is available. This is ongoing discussions that we're having now. And we have our MESH coalition. It's an emergency coalition that also has representatives from all the schools, as well as working with, we'll work with associations of long-term care to help us in this regard. So we're already trying to do our preparation. So if the vaccine will be available in November, I think that we will be very well prepared for the distribution.
Next up, we have Eric Berman from WIBC.
Hello, Mr. Mayor. Hello, Dr. Caine. I'm going to squeeze in 3 questions here, but the first 2 I think are very short. Am I correct that the mask mandate remains in effect and does until further notice? And Taylor's already nodding yes on that one. Secondly, when was the Park Indy contract last renewed, and when does it expire? And the one that I hope you'll elaborate on a little bit more. Dr. Caine mentioned 3 strikes, could be a 30-day closure. What happens on the first 2 violations, and will the enforcement be the same as with the mask mandate, or is the procedure for that different?
Well,
I think the mayor's going to talk about parking first.
yeah, the parking contract we entered into 2010 and remains. It's a long-term contract. You know, Eric, I must admit, I don't know what the
Mayor, do you want me to jump in? I got this one.
Yeah, okay, that'd be great.
Eric, it's a 50-year contract. There are escalators at about every 10 years in which the city has the opportunity to analyze that. I will say that there are pretty large financial implications at each of those stages in order to make adjustments at those 10-year marks, but it is in total a 50-year contract.
So in regard to the, moving on to the bars, that penalty, if there are 3 violations, well, we will shut down the bars. That is for 30 days, a minimum of 30 days, not 3 days, but a minimum of 30 days. That enforcement is, and the recommendations is different for an individual in terms of, I guess, trying to quarantine them for 30 days. That is more along the lines of the financial penalties that we're using for individuals who do violations of the mask.
Great. Our next question comes from Abdul Hakim Shabazz in Politics.
Can you guys hear me okay? 2 questions. First of all, perhaps Dr. Caine, why the 12 a.m. closing time? Why wasn't that moved or changed in the grand scheme of things? And number 2, is the Department of Public Health going to send people out to like a Tri-West high school football game to see if Tri-West is playing, Christmas addicts, that they're wearing masks, or help us out here on the logistics of if someone isn't following the recommendation outside of Marion County, how will public health know about that and enforce that?
Let me just take about the football question. I'll take that first. So no, we're not. It's very difficult for us to go out of county and to see whether entities are following the guidelines. But we may have current health officers from these counties that are concerned about people from my county that are not behaving appropriately. So may provide information for us, or sometimes people will send us documentation by pictures that are obtained during a certain event that we're able to determine that they are not following the recommendations. So we have an association of health officers and we try to help each other out in our communities. So, it's terrible that I have my residents in Marion County not following recommendations that are in their county because they feel they don't have to do it. I think that was one question. I'm trying to remember what the other question was.
The 12
You had
a.m.
another question.
Yes, it was the
Oh,
12
the 12
a.m.
a.m. Yes, right. So based on our reviewing our data, after 12 is the time frame where we seem to have the most complaints. People, if you want to say it, out of control. No mask, no social distancing. So that is why we selected that time frame of midnight. And I think they're very lucky or fortunate because we looked at 11 p.m., but we finalized it at midnight.
Next up, we have James Briggs from the Indy Star.
I have a question about the new guidance for bars and nightclubs, specifically the no live entertainment or dancing at nightclubs. I've been hearing anecdotally that event venues that host gatherings like weddings and receptions have been creatively interpreting the public health orders for a while now and resembling nightclubs through this entire period with big indoor crowds of people drinking and dancing. Is that the result of a loophole of some sort in the health orders, or has there been a difference in how event venues have been regulated and the rules enforced compared to bars and nightclubs?
One minute. Sorry. The thing about bars and nightclubs is that usually a wedding is sort of like a one-time event where you're having bars and nightclubs where people can come repeatedly at a bar and tavern on a daily basis. But we are definitely looking into the wedding situation and maybe having some guidelines related to that for individuals who may not be compliant of party members that are obtaining a wedding. So that is being under scrutiny right now and may end up having an adjustment to our orders.
Looks like we have a follow-up from James Briggs.
Yeah, related to that question, I've specifically heard from some people who have had plans in the works for their events for quite some time for big gatherings that would have predated the coronavirus, and venues have not been enthusiastic about letting them out of those plans, and people have felt it is unsafe to go through with them. What can people in that situation do? Like, do they have any recourse through these public health orders to reach out to the city or county for help with this situation with venues that are trying to basically force them to have a large wedding gathering, even though it doesn't seem safe to do so?
So they can definitely, I think, reach out to the health department where we can help with our public health orders, give clarity about that. And I know that a lot of times they will probably require legal assistance, but we have a number of organizations that, a lot of times these events, may have to have sponsorships, you may have exhibits depending on what the event is, and you have to make those decisions early. And if our orders currently right now says that you cannot host that, to me, that suggests that they have a legal rationale not to have to follow through with that event. But we can help if we need to, some clarification for those patrons or residents who want to get out of it. And currently, right now, you have to have a risk mitigation plan, and depending on the size of your event, happy to help say that this might not be the thing to do currently right now.
Next up, we have Mary Mills with WTHR.
Hi, I would like to ask you, Dr. Caine, about restaurants and bars that have also operated as live music venues. They've provided live music. Some seated at tables, others we've seen video of people standing, walking around. Will venues like that continue to be able to, provide live music? And will you be cracking down again on those who don't abide by the rules in those situations? So again, they're not necessarily bars or nightclubs, but restaurants with the added space. You may have seen the video of the Rathskellers, so thinking about that as well, but there are other venues that have provided live music.
So we are looking at that very carefully, and they're not going to be able to have that live entertainment. We need to continue to track down on those particular instances.
Thank you all for joining us today. A press release as well as a copy of this presentation will go out shortly. Thank you.